Good morning, folks. Well, good morning to those of you in the States and Canada, I guess, and good evening and good night to everyone else wherever you are. Thanks for joining us. Sorry, I'm just looking at the amount of people still signing in. So forgive me if I waffle momentarily and get going properly here. So yeah, sorry, I'm seeing some questions come in. So this is the webinar we're doing that people were kind of asking for, which is a COVID-19 specific webinar. And in it, we're going to look at kind of perspectives from around the world, which we were very keen to do with this, so that it wasn't just kind of, how things are in the UK or how things are in Australia. So what we've got the US, Canada, Australia, and myself from Ireland to give you perspectives on, I guess, what we've learned, whichever part of the cycle of COVID and dealing with it and lockdowns and reopening, etc., that we're actually in. So that's the idea. You probably got a mail, depending on when you signed up. You probably got a mail, asking you to send on questions in advance if you wanted it. So we got a number of questions in advance. So what we're going to do is, when we get going, we're going to start with the questions we've already gotten, which should, might cover off what you're here to find out about. It might answer some stuff for you, or it might just help ease everyone in, and then we might get some questions flowing from you guys here in the room. Please use the chat function if you've not been on our other webinars and you're not familiar with how this works. If you use the chat window on the right, pop any questions that you have in there. Myself and some of our team here are tracking those questions, so we will try and get to them as well. The idea is that maybe the questions we've been sent in advance might take the first 35 to 40 minutes, and then we'll start going through other questions as they've come up in the room. So please just pop questions into the room as they come to you. I want to thank, as always, Actavo Events. Those of you, depending on where you are in the world, you could be very familiar with Actavo or maybe not too familiar. They're a large infrastructure company that work on all sorts of events. We work with them quite regularly, and they're supporting us with these webinars. So if you've been on a lot of these, forgive me, you're probably hearing me talk about Actavo a lot. But again, they're the people who came to us first looking to kind of support us with these, make sure we had a little bit of money to get the bandwidth and everything we needed to run these and have nearly 1,000 people on some of these webinars. So we're very grateful to have them on board. Very quickly, I'm going to run through who we have on the panel today, and then I'm going to go to each of them and they'll give you a proper introduction to themselves. Once I'm finished with this introduction, don't worry, you'll be looking at 4 of us on the screen. You don't have to look at me for the guts of a couple of hours. So we're delighted to have, we've got Jim Digby from the Event Safety Alliance in the USA. Sorry, I'm getting confused already. So from the States. And Jim is also the founder of the Show Maker Symposium. We've got Janet Sellery from Celery Health and Safety based out of Canada. And she's involved as well in the Event Safety Alliance in Canada. And then we've got Alan Wilson, who's over in Australia, who's a crowd management expert from Australia, but who also works around the world, and he may be able to tell you about other events that he's been on. So the idea, like I said, is that we give you a feel for where things are at with COVID globally, as opposed to just give you a presentation with a load of slides, which is someone's experience of wherever they are. So without further ado, as they say, I am going to very quickly put a poll live, just so you guys can tell us where you're tuning in from. We're just keen to get a handle on where everyone is. So you'll probably see a poll just jump up there, and just click a button that applies. If I've missed where you are in the world, I do apologize. I didn't want a list with 100 things on it, and I wanted to get a vague feel for where people were. So I did what I could. If none of those apply, feel free to give out to me in the chat and don't pick one. So while you guys are answering that, I'm going to, if I hit this magic button, that should happen, which is really good. And Janet, clockwise on my screen, you're the first one up. So I think we'll come to you first if you want to give us an introduction and tell us who you are, what you do, and maybe how things are with COVID where you were.
Okay, so I'm Janet Sellery, and I'm originally a theater stage manager, and I got into health and safety after we had a critical injury involving an actor. So big curve change in my life, and I ended up beginning to work full-time in health and safety in 1999. I discovered the Event Safety Alliance pretty soon after they started and made myself an incredible pest to Jim Digby with emailing him and jumping on board with everything they're doing. So I created a health and safety program for the Stratford Festival, which is North America's largest classical repertory theater. And in 2008, ended that year, I left to begin consulting. And so that's what I do. I work with arts, entertainment, and live events, but primarily theater, to help them create and implement their health and safety programs through research, training, and so on. So as all of us, my life has turned into pretty much reopening conversations day in, day out. But I'll give you a quick sort of view of what we're sort of seeing here in Canada. So for those of you who are on the other side of the pond, Canada is a pretty big country that spans between the Pacific Ocean and the Atlantic Ocean. We're made up of 10 provinces and 3 territories. And we've been experiencing COVID-19 in different ways in different parts of our country. Overall, we have, as of yesterday, we've had 8,566 deaths. In the province where I live, which is sort of in the middle of the country in Ontario, we have had 2,685 deaths. So the majority of those being in long-term care, which has been historically underfunded, poorly staffed, all the problems that a lot of places are seeing in caring for their elderly. The majority of our cases have been in Quebec, which is just to the east of us. And they really had trouble because they had a spring break for their students that happened earlier in March than the rest of our country. So it meant a whole lot of people traveling to a whole lot of places and coming back and spreading the virus quite broadly. We've had a number of provinces that have had between sort of 0 and 3 fatalities. Those are typically off to the east. British Columbia, furthest west, has had 174, and our territories have had no deaths. So we have our federal sort of planning and precautions and all of that kind of carry on has sort of led the entire country. But in terms of emergency orders and restrictions, those are provincial and territorial. So we're seeing different types of restrictions depending on how serious the situation is. And I'll just give you a couple of those. So I live in Ontario, and as I said, we've had over 2,500 deaths. We have expanded now so that we can have what they call a social circle. Some people call it a bubble, but we can have up to 10 people in our social circle who need to be interacting exclusively. We can also now have gatherings of up to 10 people, provided they are physically distanced. Whereas if you go all the way over to the west to British Columbia, they have gathering sizes of up to 50 people. However, they are discouraging in-person gatherings of all sizes. They have what they call bubbles of their immediate households, and they also permit drive-in events to a maximum of 50 vehicles. Everyone has to stay in the vehicle except for using washrooms, and they're not permitted to sell food or drink. So that's, things vary, but I would say maybe Alberta has the biggest gathering sizes permitted. They're up to gatherings of 100 people. They have had 154 fatalities. They're also permitting a thing called cohorts. So within performing arts groups or sports teams, you can have a group of 50 who interact only with that cohort and their own household. So we're gradually seeing things reopen. We can go to retail stores. We can sit on restaurant patios, but can't go in and eat in restaurants. Lots of curbside pickup and delivery is still happening. Of course, as soon as they start cracking things open, more cases. A city called Kingston, about 3 hours to the east of where I live, 4 hours to the east of where I live. They opened up and they had a nail salon that had had no infections for weeks and weeks in the entire area. And now they have, last I heard they had 18 cases coming from a nail salon. London, Ontario just had a whole bunch of cases identified based on a party of a bunch of people in their 20s just getting together and having a party. And all those people then went back to their homes in different cities. So I think we're doing quite well, but we're not out of the woods. And there is a very, very tremendous feeling of caution. Lots of people working on reopening planning, but not too many of those plans being implemented yet. So we'll see where that goes.
Okay, I think you've hit on something that might be a bit of a common theme for today's discussion, is that the bottom line is, as soon as we start to reopen, we are going to see spikes in cases and things. I guess the trick, as we've been saying on a lot of the webinars and in a lot of discussions, is that the reason most countries went into various stages of lockdown was so that we can get to a point where we don't think our health systems will be overwhelmed when we do start to open and we do start to get the inevitable cases. So I think that's kind of seems to be a common thread. Again, I'll give a quick rundown on where we're at with Ireland. Jim, you hopped out of the room and back again. I think tech might be messing with you, but you're still bottom right. So by my clockwise system, you are next. So do you want to tell us about yourself and how things are great in the States?
Let's just make sure that bottom right doesn't describe my political persuasions. Yeah.
Duly noted.
I'm not going to sound anywhere near as intelligent as Janet about all of this, simply because we here in the States don't believe in science.
That's going to be the quote that comes away from this session now. You do realize.
That's all right. It is true. We have, as of just now, 2,545,250 cases. We have 126,369 deaths that we're attributing to COVID. Now, that's not to say that there isn't some manner of other deaths that aren't yet attributed to COVID. We too have had recent news stories of college bars opening. Most recently, 88 people have been traced back to a single college bar and a single infection point at a bar that opened too soon. I can't describe at all with the clarity that Janet did, because we have all manner of response to this. We have some who say it doesn't exist. We have some who say the masks don't help. And we have the fact-based information that the hospital beds are overflowing. And in several states now, the ICUs are full and can't take any more patients. We are, needless to say, in dire straits until we can get everybody understanding the implications of the virus. There was just 2 nights ago a live concert with an audience with no social distancing, no mask wearing. The artist bowled in the face of the virus. So we'll wait to see how that comes out. Look, the majority of the population in the entertainment business wants to be back to work, and our confirmation bias has us wanting to see the signs that we want to see in order to go back to work. Those signs are in direct conflict with the scientific evidence. It's a very challenging time to be on any side of this situation. And, not to make light of those, of the variety of responses to this, I don't think it's in any of our best interests to do anything other than help make the virus go away so we can all go back to work. I'll pause there.
Yeah, no, I think that's a very good point. I think we're all very, very keen to get back to work. But at the same time, this could be one of those situations where if we rush back too soon, we're going to make things worse than they already were. So again, I think that's common across conversations we've been having. Alan Wilson from Australia is next up. So Alan, if you want to introduce yourself, you've actually you've stalled on my screen. I don't know, can you hear me though? And can you talk? But you might need to log back in perhaps. Has the timing just messed with us there now? And Alan's system is stalled, just as I want to go to.
No, I was being removed and had to reconnect myself. That's why you saw.
Yeah, maybe
me.
that could be what's happened to him as well.
So
We can wait to see, does he jump back in? Again, okay. So I'm Mark Breen. Again, I'm based in Ireland, so I can give you the Irish situation, I guess. We were lucky enough, I guess, so far to start phase 3 of our reopening yesterday, which has given us some more freedom than we had. Just in line with kind of what Janet had outlined, just for Ireland to give you an idea, as of yesterday, we've had 25,462 confirmed cases, and out of that, we've had 1,735 deaths, according to the current government statistics. Now, like, I'm very wary, much like everyone else, I think, of these numbers, because depending on how they're being reported, what's being included, I think we're years away from actually knowing what those numbers truly were, and that might be better. It could be worse. I'm not presupposing either way, but I do think you have to take those numbers with a little pinch of salt, depending on where you're operating at the minute, because I know the variation in how people are recording them and what's included in them is pretty wild. I know some countries, you're only in those numbers. You're only included in those numbers if you died and they tested you for COVID. So you'll have medical practitioners who swear blind the person died of COVID, but unless someone administers a test, they don't get added into the statistics. So that's happening in a lot of places. So we need to be careful with the numbers, I think. But I think it does give us a good picture of where things are at. Janet, the very first question that's I saw in the chat was Eric Stewart wanting to know if you plan on erecting a massive wall to stop those pesky Americans coming across the border into your space.
We have no plans to build a wall, but I have to say there was a fair bit of meme action on Facebook when they talked about dispatching the military to prevent Canadians from getting into the US. Not a lot of people trying to make that trip right now.
No, I'd imagine not.
Yeah.
I do think Eric jests there. Folks, I have a funny feeling technology is messing with us because we're spread all around the world. So if you're suddenly seeing people pop in and out of the room, I think it's because they've been kicked out by tech and have to reconnect. I know Alan's been having a nightmare today, and Jim's been kicked out a couple of times. So forgive us if that's going to keep happening. Janet, for now, I think we can head into this first question.
Sure.
And maybe you can take it, and then when the guys come back, we can kick it over to them. So the first one that came in that we have here is someone says outdoor events are clearly starting to take place, such as outdoor cinemas. Does the panel know who was giving these events permission to go ahead, where there has been no official government advice indicating they should? Now, I'd imagine, whoever sent that question in as such is talking about their country and their, the situation there. So as regards official government advice, for some of us, it may be different. Maybe they are specified. But what's the situation in Canada on that?
Well, in Canada, again, it varies from province to province, but certainly taking, we know that the virus spreads indoors. So anything we can do outdoors is going to be, much, much better, much healthier. But we have some pretty serious restrictions around drive-ins. There are, as I said, British Columbia and some of the other provinces are permitting them, but it's typically quite restrictive in terms of numbers. I don't know I'm not aware of people who are going ahead to have these events without government approval. Perhaps there are, but I'm not aware of them. I think there are people who are putting plans in place, hoping that by the time the date comes around, our gathering sizes will have increased. But there are a few happening, and I think that's probably a positive thing. I know there was someone in Ontario who ran a drive-in movie theater and started up before it was actually fully permitted. And so there was some ticketing, I think, that happened. I don't know that there was actually a fine, but certainly an educational visit. There is in Toronto an event which is an art exhibit, which is you have the option to it's a Van Gogh exhibit with huge format sort of video of the artworks on walls, and they set it up so you can either do a walkthrough or you can do a drive-through. And I know they had a lot of oversight. That seems to be going ahead.
That's an interesting way of approaching it.
Yeah.
Sorry, Jim, we had just explained that you and Alan keep getting kicked out of the room and having to come back in again. So we were just looking at that first question, and actually Chris in the chat has confirmed that it was him that sent the question, and he is UK based. So This is something they're wondering about, obviously. Jim, have you seen much of that in the States? I don't know, can you see that first question that we were talking about there about the outdoor cinemas and who's giving them permission, etc., if there's no government advice? Are you laden down with superb government advice on what you can and can't do over there?
I think that's that's one of the challenges of the States. Yeah, that there's the different levels of government impacting what's happening. There are all manner of the drive-in event types happening. I suspect that of the variety of things we can attempt to achieve during COVID, the drive-in option is technically probably one of the least contaminating options. Whether it satisfies the need to attend an event, whether it satisfies the thump of the music gene that you're trying to trigger, if it satisfies the emotional experience of a live event, that's an individual takeaway, obviously. But the drive-in movie thing is happening. It's different from area to area, how it's looked after. As was the case with respect to this concert the other night in a venue, I don't believe it was governmentally approved for that to take place, and that is part of the issue. Yeah, is that all manner of folk can go out and give it a shot and have damaging retroactive effect to the entire industry. So it's one of our challenges.
Yeah, I think to be fair, and I know drive-in events come up specifically in one of our later questions as well, so we can go back to that. But I know in the UK, from talking to a number of colleagues over there does seem to be a proliferation of people advertising these drive-in type events without their correct licenses at the time at which they're advertising and promoting and selling tickets. And then they're coming back with the whole, well, you can't disappoint all these people now to the local authority, you have to give us a license and all that. So again, I think it's probably typical of, I guess, how the industry can work. It's the microcosm of a macrocosm. There are people who want to do it properly. There are people who'll try and sell things before they have a license and then hopefully put the pressure on to be allowed to carry on with the event. So I do know in the UK, there's a lot of it going on. Now, it also has to be said, there are plenty of good companies trying to do it right and bouncing, ideas and information off each other, doing everything they can just to give us something back and to start doing something.
Yeah, I mean, we've got to start somewhere, right? There has to be some attempts. I think one of the hopeful outcomes of the ESA releasing the reopening guidance was, listen, let's all agree as a community, if we're going to try to do this before there's a vaccine, let's try to do it as safely as we possibly can. Here are some steps that you can take. And, there's been good guidance in a lot of different places. And the idea of being able to reasonably foresee the risk and mitigate that risk when you're opening is the way we should do it. No one can, there's so much variety in the damage done and the needs for people to get back to work that people are going to take risks, and it's a real challenge, and those risks can have an effect across the entire industry, unfortunately.
And one of the things, just speaking about risks, is there's a lot of positives to doing things outdoors, and that's great. And there's a lot of people who do that really well, but we need to keep in view all of the original risks about going outside. For a group of people who normally produce at an indoor venue, if they're going to take it outside, now they have a whole new series of risks, not just about COVID-19, but thinking about weather and insects and heat exhaustion and traffic. And, I don't want people to think that it's the same thing. You have to go back to your risk assessment. You have to start all over again, and you will need different expertise to make that work safely. I think the drive-in option has lots of possibilities. I know here people are very cautious about being first. So I think it varies around the world as to how people are feeling. But right now, I'm certainly talking to a lot of people that you have to get it right. Because if you're the first out of the gate and you don't do it right, you are going to cause damage to the entire industry. So we're having a lot of conversations about collaboration and the idea that where once different companies and different venues would be competitors, now it's to everyone's benefit to collaborate. Because if we can get people talking about precautions that they would commonly adopt, and the ESA reopening guide is something that I'm promoting as sort of a, here's your starting place. Look at this stuff, and then look to stuff that's more specific to what you're doing. But have common language, have a common approach, because we have to get this right, and we have to protect artists.
Well, I think it's also, Janet, it's if you've done it, what's the lessons learned? So we're also attempting to capture all these lessons learned. It is kind of day one, starting all over again. What I know that none of us would want someone else to repeat a mistake that we've made and could have advised them for. So we're trying to bank those lessons learned, as I know you guys are, and let's get those out there to the community as well. So that we can keep moving forward.
Yeah, it's one of the things that I'm personally quite hopeful might be one of the positives, and I know I'm known for saying this now at this stage out of this whole situation, is that sharing of information, that sense of community, that we are all one unified industry, even though we rarely think of ourselves that way, that this might hopefully prompt us to think more that way and act more that way. I mean, even just watching the chat, people are echoing that risk you're talking about, Janet, where people don't want to be first. And in parallel to that, people are worried that those who do go first may not be the ones who will try and do it properly, fully risk assess it, and may actually cause issues for the rest of it. Because at the same time I say that, I'm telling people this is new to us all. All you can do is come back to risk assessments and do what you can and be reasonably practicable and all those things we tend to do. But literally nobody has the answer. The experts in COVID-19 do not work in the event industry. They work where they are more needed.
Yeah, so, and they don't even have all the answers. They're still understanding the virus.
No, 100%. Absolutely. Yeah. I mean, that's good. We'll move on from that only because I know we're coming back to kind of drive in another while. We'll hop to question 2. Now, question 2 is slightly long, but I think the context is important. So forgive me while I read this one out. So I'm in a country where cases are still comparatively low, at less than 1,000 confirmed cases at the time of writing. He says there's currently no lockdown, but restrictions on events occurring came in early, though some still happen under monitored conditions, like a drive-in outdoor DJ festival. Internet use is low and costs relatively high, so online events where he is aren't really the solution. So given what we know, do we have any advice for safely holding events when there are limited infections in the country beyond just saying don't? Or to put it another way, he says, are there any ways for a country early on in the curve with COVID to functionally maintain an events culture based on the learnings from the rest of us who have had to kind of shut it down? Janet, any thoughts on that one? Is there learning there yet?
So is this a country where they're sort of at the bottom of it, like they're beginning to get cases?
That seems to be what he's saying. It came in about 3 days ago. So at the time they were saying there was less than 1,000 cases. So in his mind, they're definitely kind of early on in the curve of, is this thing going to get
so they're heading up?
Yeah, exactly.
Okay, so my feeling would be if you're heading up, the best way to flatten is to shut it down. That's what we did in Canada. It was heartbreaking. I live in the city of Stratford, Ontario, where we're a city of 34,000 people, and we have a gigantic theater that has canceled its entire season until November and put 900 people out of work, in addition to all the B&Bs, retail and restaurants that are supported by that tourist base. It has been agony, and yet we have in our county had 56 cases and 6 fatalities, of which 5 were in long-term care. It is a hard thing to do, but I support that. In terms of when you get over the hump and you've had a big decrease, that's when I think you can begin to take very measured steps, tiny. Like we're at a point where I'm talking to people about figure out how you can get back a few people back into your office, figure out the protocols, get that ticking over well, then think about, can you get some technicians back in to do lamp maintenance or inventory? Okay, then I know of a theater in British Columbia that is making some plans to do a staged reading with an audience of 50 people, and they're making sure that they get that sorted properly. And I encourage, that robust sort of post-mortem review, I'm encouraging people to do surveys. So if you have 50 people come to your show, send them a survey monkey and say, how did you feel? Were you comfortable? Did it look like it was working? Same with your staff and your artists, because we have to get a core group of people who feel comfortable, or they won't come. In Canada, they won't come back. In the US, maybe they will. But that's, we have perhaps a lower tolerance for illness and death. I don't know how that comes, but but it's just, the culture is going to affect the choices you make, and our choices are very cautious.
No, I think that's a great idea, though, the likes of, the survey, if you do get 50 people into that room, but even among your own staff. I mean, one of the things I think that's important is we as an industry, as event professionals, first off, loads of people don't even know we're an industry and that we are professionals in events anyway. Yeah. So let's park that, because we all have a chip on our shoulder to some degree about that. But then after that, we have to help ourselves. So like, governments aren't experts in what we do. Like I said, a lot of them don't know we do what we do. So it's up to us to gather stuff, and things as simple as, say, everyone in Canada who starts to run stuff, getting those survey monkeys, getting that data together, being able to, at some point, if it matters or there's someone to show this to, go, look, here's what we've been doing. People feel this level of comfort. We've actually done this since, and we're hoping that improves their level of comfort. We have to be proactive. And I think being proactive for ourselves and our industry isn't about rushing back. It's about, like you said, phasing back, but getting as much value out of what we can do and each phase of us coming back as we can. And I think data like, did you enjoy it? This one simple question could go an awful long way. How comfortable did you feel at this event? And a scale of 1 to 5. And let's start to do that and use that, because we'll have to, I think we're going to be, when I say we in the broadest sense as the industry, it's probably going to be promoters with deep pockets or whatever, but like, we will have to start doing stuff again, and we want it to be done as well as possible. I don't for a second think the first people who do something big that we'd all consider big are going to get it 100% right. But much like, and I don't know if it's happening where you guys are, but in Ireland, as we've gone through phases of trying to reopen, there's this interesting, I mean, Twitter can be a cesspool of horrible, angry people a lot of the time, but there's this interesting thing in Ireland where a lot of really positive stuff is coming out, where people are going, look, hairdressers are reopening tomorrow. Lads, take it easy. Don't all rush in there. Don't be freaking out and putting photos on social if someone drifted within a meter of each other. We're all here trying to figure this out and get through it. I mean, Jim, what's it like in the States? Have you, like, the word in the question was, is there learning yet? And I'm just not convinced there's much learning yet that we could pass on to a country and go, oh, hold on, you're early, so do these 3 things and you can keep your industry open. I don't know, is that there? Is it?
Yeah, I don't think we're there yet. I really don't. Okay. I think, measured and reasonable, as Janet described it, is the order we should pursue. I think, look, my personal risk tolerance is pretty low, and I think as much as I understand the plight, because I too am living among the unemployed, and want to get back to work, and I'm sure that my family wants me out of the house. It doesn't do any good to go back prematurely, cause an outbreak, or get sick, and then not be able to provide for the family. And there are, the risk tolerance spectrum is as broad as it gets. And one might leave their house, this is kind of drifting from the question, I apologize, but one might leave their house to try to go back to work, while those others who stay behind in the household are extremely upset by that or nervous by that. And now you've caused this kind of collateral damage to the family unit, and only for the reasons to get back to work and get a paycheck into the household. So there aren't, I don't believe, reasonable case studies yet to say, hey, here's the model. Here's what we need to be doing. I personally think that, the auto racing sector that are doing it without an audience, golf without an audience, these kinds of things where the drivers and or the players are able to maintain social distancing and or wear a mask. And these are good starting places for us. When it comes to a live event, I don't know if playing to plants, as was recently done, tells us anything. Although the Los Angeles Philharmonic just did a performance at the Hollywood Bowl without an audience, with the orchestra well separated from each other. These are those kind of tiptoe steps back to it that we've got to take. But then we've got to allow time to analyze the success or failure of the steps and where we went right and where we went wrong. Yeah. Rushing back, I think, is a recipe for all of us to endure further pain, I fear.
No, I think you're right. I mean, we've been lucky enough, well, I say in the grand scheme of things, lucky enough in that we've had clients who we've been able to do some live stuff for in the last month or so. Dublin Pride being one of our biggest ones, which couldn't happen in the way it normally would, of course. But we were able to do some recording stuff and then some live broadcasts. And, I say a live event that had about 10 people at it, but it was a live event. And you're just, you're feeling your way through it. You're seeing, and I think Janet hit on a really important thing. It's about how comfortable are the crew and are the staff, as well as the attendees. We're all already living in fear that by the time we do come out of all this, that a lot of the gig economy, those people that this industry relies on, will have had to go off and get other jobs, and we're going to be short good people anyway, is a fear that a lot of people are articulating to me. So again, we don't want to rush back. And listen, we'll all say it, no one wants to be back on festivals or running shows as much as any of us. Yeah. But we really, really have to box clever with this one and not rush it, I think.
And I think Janet also highlighted another thing that's obvious for all of us, is that the outdoor events are the likeliest, best places to give it a start, right? There's no question that the science now is confident on the viral load inside a space. If you're in an enclosed space and you're dancing to the music or you're singing along with the music, that viral load continues to get greater and greater in a closed space, even with the air circulating, even with HEPA filters and all the rest. And there isn't, it takes that kind of extreme viral load to make it a highly toxic soup. Outside, same amount of activity, same amount of people, and the climactic occurrences of wind and the space between you and somebody else help to make that situation less of a threat. So I guess if there's any advice to offer, is start outside.
Yeah, I think that's about as much learning or advice as we can give now. So I think to be honest, when I saw the question first, I thought we could say very little. We've said quite a lot. Let's move on to the next one, which I think is quite interesting, and it may be loaded to a certain degree, but it's fair. Is it reasonable to expect event organizers or promoters to actually enforce social distancing at events? So beyond putting in a range of practical measures like enhanced cleaning, distancing in queues, queuing arrangements for toilets, etc., is it fair to expect anything beyond that? And this is a conversation I've had with a lot of people around the world, trying to see where they fall on this. Is that, like, if we were expected to enforce it, we can't all, that's not fair. A lot of us can take our event, we can do the maths, we can figure out from our figures how many people we could let into that same space where they could all keep 2 meters between one another. We all know they won't use the space that way. And that's unhelpful depending on what room you're in, but that's the truth. We know if we run a show, they won't all use it that way. And then if you look at research like the Institute of Place Management in the UK have done some great work specifically on retail space, but it would apply in a lot of ways, in that we're all picturing static space. So we're picturing a queue that we can manage. We're picturing 2 meters, like everywhere you go, 2 meter increments are marked on the ground. But if you're in a dynamic space, so if you're on a high street, or if you're in a festival site where people are moving in a variety of directions, it's not controlled beyond they're within our perimeter fence, then the maths have been done to say that you need between 10 and 12 square meters per person to allow that 2 meters to be maintained as we dynamically move around the space. So I guess I'm kind of giving away where I fall on this question, but what do you guys think? Janet, do you think it's reasonable that we take that on to try and enforce, and I'm talking generally because obviously with some types of venues and seated venues, it's much easier to achieve. But in general, is that something that promoters and organizers should take on?
I think they're going to have to in the short term. I would not foresee a general admission event being reasonable to do at this point, which is incredibly difficult. I know that even going to, so I was in a dollar store yesterday and they had the arrows on the floor, and I started going up the aisle and someone's coming in my way and 2 people are stocking shelves. And I felt very uncomfortable with that. So would I go to an event where I felt that that wasn't well managed? I think it starts, so the ESA reopening guide has some really great information about communication and how to sort of build that understanding between the patrons and the event staff, the venue, that we are sort of not necessarily a written contract, but we are taking on a sort of social contract that we will do things to protect each other. And so we need to put that into, the ticketing platforms and say, we're going to be doing the health questionnaire when you arrive. You must be wearing a mask or you will not be able to come into this. It's the same thing. You're not allowed to bring your own food into a festival. You're not allowed to get reseated in your theater except at a reasonable point in the production. We do always have things we have to comply with, and these are more. So I think there is a huge obligation on the event organizers, the promoters. We had a situation, there was a situation in Toronto where there was a big park. They suddenly reopened parks. Parks have been closed. And suddenly on a beautiful sunny summer weekend, it was just packed, thousands of people. And there was a huge uprising about it. And then over the week, they put these circles. And the following weekend, people did comply. They went and they sat in the circles. They stayed apart. I don't see how this industry is going to be viable if we can't get those things to happen. It's never going to be perfect, but we're going to have to manage ingress and egress and washroom lineups and food and bev. And, some of the theaters in Toronto are looking to apps where you can order from your seat so that food and bev would be delivered. They're not going to be pouring wine, but you might get a can of wine, or I don't know. That's not my thing, but I do think we're going to have to take on, I think we're going to have to. I don't know. I want to hear from Jim on that one.
Well, I don't know if you've been watching the news out of the States, but I think our citizens are in violent disagreement with what matters, right? And that's, for us and for event organizers here in the States, that's a huge challenge because it is all manner of response to, you see video coming out of grocery stores where someone comes in without a mask on, even though the grocery store says you must wear a mask to come in. And then when they're challenged on that, they get physically violent with those who would challenge them. So, and I have another analogy. My son was going to try to go back to Little League baseball, and the coaches had written and disseminated information where these things were going to happen. There would be no chewing of sunflower seeds and no spitting of the seeds, for example. And on the very first day where we went only to observe while the rest of the kids played, there was a kid, jaw full of sunflower seeds, spitting them onto the field. And we made the decision that we're just going to have to skip it for this year. So when it comes to managing the event site, I don't know that promoters, we assume the risk. We assume that duty of care as the promoter, as the venue manager, and we've got to then make sure that our folks are, reasonably make sure that our folks are behaving according to the rules that we put in place for the venue. But I don't think we can count on people who are coming to a music event and perhaps drinking and all the other things that come along with a music event to manage themselves. So unless we can get to this state of play, Janet, that you described, where we're socially concerned about each other and we actually care about each other and we mind the rules because of that, then the only other option at a venue, inside or out, to ensure that the rules are being followed is to physically barrier those things, right? You must create the physical barriers which prevent folks from breaking the rules. Well, does that experience add up? Again, it goes back to the individual and the corporate's risk tolerance. Does it add up to do those things? I don't think that we can count, certainly here in the States, it's proven already that we can't count on the public to look after each other. And therefore, perhaps the venue operator, owner, promoter, whoever's in that duty of care should consider barriers to prevent this exchange.
Or carry on and see what happens. And the industry will be, the industry will have to take its lumps if people are unwilling to comply. I somehow on Facebook went down a rabbit hole with Disney World because I clicked on something to find out about their reopening, and now I'm seeing, but the comments are all like, well, I'm not going to wear a mask in Disney World in July. I'm not going. And you go, great, don't go. But, this project, this event is for people who comply. It's not for the rest of you.
Yeah. And I do know that the people are confused, I think, also in the industry because the booking agents continue to book tours and they continue to try to look out over the horizon to ensure that they've got venue availability. And that's, people see that, and that causes kind of a false sense of hope. And there are some tours that have been rebooked 3 and 4 times already, but that's the proactive measures the booking agents should be taking to get there. I know that our friends over at Formula E are looking at their schedule and bringing their schedule to life, and I think there's probably a step there where they do it without an audience, and it's less of a challenge than to do it with an audience. I know our friends in Saudi are talking about getting things back online. The challenge is, are people ready to leave their homes? Have we provided an environment for them that they can feel that their health is being looked after, and does the environment still pay off? Was it worth the risk? Was it worth the trip? Was it worth the expense? These are bigger questions than we can answer now because we still don't really know. We're in bad shape with that.
And I guess that's the other risk of rushing back. There are lots of risks to rushing back into stuff here, but the other is, like, if you can get nowhere near the experience people want and need, other than the very important stuff of we need money to come in, we need to stay in business and all that. If you can't actually supply an experience people will like and enjoy, is there much point in doing it at all? And the other thing is, as Janet says, events, when they start, like, they're going to be for people who will comply with the rules. So all that talk can go on around and everyone can give out and complain. That's fine. Let you be the people who don't go. And let those of us who crave that experience and want it enough and are aware of the rules because they've been communicated well to me, I will go, yes, I am happy with that. I'm going to go and see what this experience is like. I'll comply with those rules. And if you get enough of those people, hopefully then things start to kick on from there, and people become a bit like the social distancing when I go to the post office or the shop. It just becomes kind of habit and common now. So if you got to a stage where events where we used to be tighter packed and happier being that way, we're now all spread out a bit more, maybe that becomes the norm for a length of time. And we'll have, maybe, if that lasts too long, we'll have forgotten what gigs used to be like.
Yeah, I think the other cautionary tale there, Mark, is that every event type has its own specific signature to what the risk load might be. And what do I mean? So if I'm going to a choir event with a whole bunch of people singing on a stage in an indoor venue, that's a lot of viral load potentially coming off of that stage versus, as Roger Hooker has said here, they're going to do 6 races indoors in a closed venue, or in a closed venue, not indoors. And I don't know whether there's an audience there. That's a different risk profile than a wind instrument show of those. So we want to make sure that we're cautioning everybody to, not just do the risk assessment with respect to social distancing, but how much viral load am I creating as a part of this event? And that changes indoor venue to outdoor venue, wind speed, weather, all of those things.
Well, even as, again, I think it was Eric Stewart popped it into the chat there as it was flying past me. was that, you know, there's research being done into orchestras and, you know, the viral load of them performing, and I think he said it was something like 180 times what it would be otherwise. And like, I think that's it. If there was one message, and we just keep coming back to it, you have to risk assess it properly. I think people like us who do this work, we've always been the ones putting our heads on that block to some degree. That's what we do. And I think maybe, is it just a bigger, more visible block at the minute that we have to put our heads on? We have to risk assess properly. I'm glad, actually, I knew Roger was here. I'm glad he's just popped that little bit of info in. So Formula E in a closed venue, finishing off their season with 6 races. And again,
no audience.
Yeah, no audience. We could spend days chatting to Roger about what they've had to do to get to that and to be able to put that on. Yeah. And, you know, and the reasoning behind it and everything like that.
And interestingly, that's happening in Berlin as well, where the authorities are, you know, they're paying attention and they're engaged and they're involved and they're smart about our business.
I'd say that's no coincidence.
No coincidence.
Just to come back to something that Mark said much earlier, is that I really agree that people in public health don't necessarily see the events industry as being filled with highly qualified professionals. So they may only have a vision of what their experience is when they've been to an outdoor festival, without any concept as to the control room, the traffic planning, the logistics, the safety, the risk assessment. They don't have an understanding of that for our industry as they might for a factory or, you know, transportation or something like that. So I've been encouraging some of the folks in various arts organizations in provinces that are likely to reopen soon, is to say, put together a plan for how you can effectively deal with a small event. And, you know, don't, because when like in Nova Scotia, they were talking about they were not allowed to have mass gatherings. And in their public health realm, it was thought that any outdoor event was a mass gathering. No, you know, we're not talking about 10,000 people. We're talking about 50 people in a park, sitting in a circle, you know, wherever it is. So you need to lay out your assumptions, and you need to lay out your precautions, and you need to teach them that you have the credentials, the experience, the perspective to be able to create a safety plan that is as unique as your organization, your event, and your venue. You know, that it's going to be very specialized, and that people in this industry are really, really good at that. We can't lose sight of it.
And you, I think it was you, Janet, mentioned it there on that thing about a common vocabulary. And look, at this is a conversation that comes up regularly in our industry, and I know it does over your side of the pond too, where whether it's between public health and local authorities and ourselves or whatever, but that common vocabulary on the safety side for events just doesn't really permeate yet. It's not out there like what's a mass gathering. Depending on where you are in the world, as you said, people think anything outdoor is a mass gathering. Here we can have 50 people at the minute. You can have up to 50 people, and that isn't letting too many people get going. But that's only since yesterday. So I've just actually, sorry, we've mentioned it a few times, and apologies, I should have been more prepared than this. But I've just shared the reopening guide there, the link for anyone who wants it. We might pop on to the next question that came in, which was, where does personal responsibility come into things here? Isn't there a chance, sorry, let me broadcast that. Isn't there a chance that people will be safer at a well-planned and managed event than they would be walking down the street in town or even in their own homes? And that's I think that's an opinion and a comment that I've heard a lot over the last couple of months, and I get where it's coming from. I'm interested to hear what you guys think about that. Janet, what do you think about that? Isn't there every chance that if you or I or Jim or Alan ran the most amazing event in the world, that they could be safer there than they are doing their shopping or going to that dollar store where you've ended up feeling uncomfortable because 2 people were in an aisle?
Yeah, I think that's true. I do think that's true, that we probably can do safer events than some of the sort of free-for-alls that may happen in people's personal lives. But we have to, you know, as soon as you invite people into your venue, you are taking on the responsibility, which is not the same as if you're gathering with a group of friends in a park. Not that I'm concerned about liability, because I think it's really unlikely. I've had questions from people saying, do we have to get people to sign waivers? What if they get sick and they blame this event? Well, you can't tell me that you haven't been to the grocery store, you haven't, gone to the big liquor store, whatever. I don't think that's the problem, but I think reputationally, if people go to your event and they get sick, they're going to be talking about it, and that's going to inflict damage on your event and the entire industry. I wish people had personal responsibility, but I believe that we need to set it up so that they have to comply. But that's very much a personal opinion. Yeah. I don't want you to think that I'm speaking for all of Canada, although I see there's a few Canadian names on the chat.
You've got a few there, yeah.
But that's my opinion. I think we need to set this up so it can happen safely. And then we need to say, you're invited, provided you comply with these things.
Yeah, what do you think, Jim?
Well, I think were our attorney, Steve Edelman, on this chat, he would say that the first person who has responsibility for your duty of care is you. So the individual attendee has an expectation of safety when they arrive to any event, regardless of COVID or not. And our duty is to ensure that we can meet that expectation of safety, but they also are expected to look after themselves and behave in a reasonable manner for themselves. So with direct respect to that question, first the individual needs to be taking their own responsibility. And that means currently in a COVID world, wear a mask, wear a mask, wear a mask. And then as we build events, we should be making sure that we're doing everything that we possibly can within reason to ensure that masks are available, hand washing stations are available, that surfaces are wiped down, and all those other practicable things that we can think of at the moment to make sure that the venues are ready for an audience. I don't know that unreasonable behavior, I'm fairly confident, doesn't fall to our concern, the promoter, the venue, the entertainer. If you're going to climb the speaker tower, that's on you. That's not on us for having put up speakers. So I do think, go ahead, Mark.
Yeah, no, I was just thinking Janet hit on something interesting that I've been speaking with a lot of clients and people about, but again, I'm wary to touch on sometimes. But the bottom line, I think, is that from a risk perspective and a perception of risk, like no one really is going to be able to sue you and say they definitely got COVID in your shop or at your small event or at your recital or anything like that.
That's the other part of it.
Yeah, and I think, and again, we found it with a lot of the businesses, just normal businesses, high street businesses reopening here. We've had to do, and we did an ebook specifically because this is what kept happening, was people were really over worrying and over egging the risks here. And there are risks you need to, for a hairdressing salon, for a shop, for any of those normal businesses to get reopened. Like, they just need to be reasonable, do what they can, follow that public health advice. I know people who are staying up at night thinking, even when the government says I can reopen, I'm too scared to reopen. What if Mary comes in and says she got COVID here? And I'm like, okay, well, let's knock that in the head straight away, because realistically, Mary's not proven she got COVID here. Poor Mary, I'm sorry for her. But, so I said, let's move on from that now. Now, let's just look, what do you need to risk assess? What are your touch points? As Jim said, let's do it systematically. What space how do we change your space? How do we make more room? How do we clean more often? How do we have all these facilities available that we didn't need before? And then just get on with business. I mean, that's the trick. People need to have the confidence and not be so scared of risk assessments. Easy for us to say, we do this all the time. But if we can help people kind of demystify the actual risk assessment as a thing, no one knows the hairdresser's business or the bank's business better than they do. So employing any of us to come in and do their risk assessment, I think, is a bit silly. Go on. Yeah,
I think the other thing that we need to reiterate to folks is, there are all manner of, I can save your event with these tools, devices happening right now. Take the temperature and that solves everything.
Let's not talk about the temperature thing. We'll be here all day.
So what I mean is that people are deploying these things. either intentionally for the perception of safety, or they're not really well informed enough to know that they're not going to solve the issue for you. And in fact, the science is that the highest viral load is before, as a person who's carrying it, is before you show signs. So I'm most infectious to other people before I have a fever, before I have any other signs. So while all those measures are interesting and they can be deployed and they provide a level of comfort to some folks who may not have done their homework, they are not the tools that are going to save the industry by any means. So wear a mask, right? It gets back to that. The one antidote that everybody seems to agree on is that mask to mask communication, mask to mask exposure is the highest and most effective thing to be done.
And
right?
Yet, oddly, and I think it's happening to varying degrees everywhere. It's not unique to any of us, but there is this resistance to wearing the mask. And I mean, the bottom line is, if everyone's prime minister or went on TV and had 10 seconds to advise the country, they'd go, wear a mask. Until we tell you otherwise, wear a mask. And let us tackle this. But the mask thing is just weird for people. And it's funny you mentioned the likes of the temperature thing and the tools and all that. That risk perception thing, and Jim, you mentioned it. And in every other situation, I find there's value in it as well, in that if people perceive something to be helping them and keeping them safe, perhaps there's value in that. I find myself much more conflicted with COVID. And I'm not on that train of, well, if people think temperature checks are a good thing on the way into their big factory, let's do them. I actually think that's really dangerous in this particular instance for COVID, because then people will think that's an effective mitigation measure if it's over there and if it's here and if it's at the event or whatever. It's teaching us the wrong thing. So if a temperature check is telling us, the external skin temperature that we have, it's not actually doing anything really. And I do think there's a risk. And it's
especially if the external temperature of the air is higher than the temperature you're trying to check on a human.
Or if you've cycled to work, so you're a bit sweaty, or you came out of a really air-conditioned car. Again, I'm falling down my own rabbit hole. I said we should not talk about it.
I think, look, to be fair, someone has made a comment that these are not tools marketed as an industry-saving solution. I personally am receiving emails from people saying, I will save your event by giving you these tools.
Yeah. So let's be fair, much like everything else, and we'll try to be balanced here in the same way as I've already acknowledged there are good, there's good event organizers and there's people who take a chance. There are people advertising these as this is your solution because that's what they sell. So Michael, you're dead right. There are some people not advertising it that way, but I'm with Jim on that. I've had the direct approaches because of some of the clients we've had them. We work with some government clients. So we've had those people come straight to us with these temperature checking things. And this is just an example, sorry.
It is.
There are others out there. It's just the current one that's on my mind.
And it's not to say that those tools, I don't know why tools is the operative word. It's not to say that those mechanisms aren't helpful in the perception of safety, and that they may in fact catch one or two folks who have a fever who didn't know they have a fever. Those are good things. I'm not knocking any of those things. But it's like the TSA here in the States. We've caught more people with illegal sized shampoos than we have terrorists walking through the traps because of the TSA perception of safety. So it's really more of a remark, and I apologize for generalizing it, that let's not only count on these mechanisms and give a false perception of safety. Let's also enact all of these other things like mask to mask, which is the most important thing we can do right now.
And I think that's fair enough, and that clarification is cool, because I think definitely there might be scope for it, but in the ways personally I've seen the temperature checking thing being sold into the industry and sold into clients, it's not being sold as part of a broader suite of measures and stuff. I'm sure someone else on here could say the only way they've seen it or been approached with it has been the proper way. I guess I'm only speaking from my own experience. The next question is actually the one that comes back to drive-in events, and it's interesting because what this person is looking to get from us, sorry, let me just broadcast it here, is actually, other than the COVID stuff, what other safety things should they be thinking about for these drive-in events? I mean, there's a lot to it, and I know you guys and I've had conversations across borders globally about how they run them and what's important and whether engines stay running and all this stuff. So I guess maybe this is from someone looking at running one and thinking, right, doing what we keep telling people to do, don't get completely caught up in COVID, risk assess the individual event fully and figure out all the other risks as well. So Janet, I guess at the top of your head, what are the other risks that we need to be clued into for these types of drive-in events, I wonder?
I think traffic management will be really important. Getting people to their spots, that's going to happen over a period of time. But the egress, making sure that people are well organized, making sure you don't have people who are, out of their cars, some kids kicking a ball around and people are driving. I think that's a big concern for me. Having some sort of marshaling where people have a high-vis vest on and have a plan for, with 50 cars, probably not a big deal, but if we're looking at getting the drive-ins of a much bigger scale, I think that that's going to be really, really important. And then, a lot of the other things would be similar, washrooms, food and bev, all of the concerns that you have about, managing those aspects. And what are we showing? Are we showing a film? That's one thing. But if we're going to be putting a concert on or any other kind of live performance, then we have all of those hazards that go, from setting up the temporary stage and load in and load out and lighting hang and all of those activities as well, which if you're already accustomed to doing those things and the only difference in your event is that you're bringing cars in instead of walking people, then you may have all of those concerns addressed. But if this is an entirely new thing, you need to make sure you have the people on your team who are prepared to help you plan for those things safely, I think.
Sure. Jim, what do you think?
Yeah,
Are you a fan of these drive-in events?
Well, I'm a fan of our industry attempting all manner of things to get back to work safely, with the caveat safely. Yeah. So I'm not a fan of the drive-ins. Is it an experience I would take my family to? I'm not sure. But if that's all there is, maybe I would. And I think, Janet's highlighted all the things that are potentially many of the things that are potentially problematic. The only other thing I can think of off the top of my head is, is alcohol consumption happening inside these cars? Because the opportunity to police our audience, or not police, but manage our crowds is different than it would be were they standing inside a stadium or festival floor. So, what's happening inside the car? How do we intercede in case somebody's in trouble inside a car? There are these other considerations that come along with the drive-in event.
No, I think that's a good point. And I'd love to see people doing drive-in events who've done drive-in events before. I fully understand, to use that word I hate, people in our industry pivoting and doing them and trying to do them. I think Janet's right. You need to involve people who understand that particular type of event and then add in, the COVID stuff and figure it out. But one thing that's always fascinated me and I find very challenging and interesting with any type of a drive-in event are the emergency situations. Because even if you think before COVID, a normal drive-in event where at any given point in time, some are in the car, some are out of the car, some are over getting food, some are going to the bathroom. If you then have an emergency that prompts people to leave site, some are on foot, some are behind the wheel of a car, possibly with an engine running. Instinctively, they're probably going to drive. So you're into an awful lot of management around emergencies then, which I think is quite challenging for drive-in events and maybe doesn't get considered maybe as much as it possibly should. I think we have one more question out of the ones that came in advance, and then we'll try and get to some in the chat because there's some very interesting stuff going on in that chat. It's moving so quickly, I'm kind of struggling to keep up, but I'm seeing some of the comments. As usual with these webinars, people are getting a lot of value out of the chat and they're having their own discussions over there and disagreeing with each other and agreeing.
Yeah.
Let me just, I'm going to broadcast this one and we can all discuss it as well. Oh, actually, I forgot it was about emergency. So how should we account for COVID from an emergency perspective? Many situations won't allow for social distancing during evacuations, for instance. And again, I actually got a call about this during the week, this exact thing where a client went, right, emergency situations. Am I focusing on the emergency and where does COVID fit in. And again, it was over an hour of a conversation to kind of talk through it with them and kind of work it out. But Janet, what do you think? That there is definitely, it's come up multiple times with me, and I know what you guys do, about how you adapt, or do you adapt the emergency side of planning to factor in COVID, and specifically I think social and physical distancing is what people are getting at.
I think it's a really good opportunity to go back to, like, even if we're thinking of a fire safety plan for an indoor venue, it's a great opportunity to go back and look that over and figure out how you're going to deal with it. The other thing we need to be thinking about is, in addition to our ingress that happens over a period of time, to be having a real focus on our egress. And when we do that, and we look at how, much more formally within whether it's indoors or outdoors, formally look at which exits do we want people to use, and make sure that we have, whether it's ushers or event staff, to direct people very, very specifically to those exits. Now, the more, I've had the privilege of sitting in on Eric Stewart's crowd safety 2-day workshop 7 times. And so I have had access to a lot of his thinking and expertise. But what I really take away with that is the better you prepare people for an emergency at the outset of your event, the better you communicate it when it begins to happen, the more likely that you're going to have a calm and rational sort of evacuation. Staff it well, train it really well, and then, we're going to probably have people who are within 2 meters, but hopefully for a very, very short time.
Sure, yeah.
So it just goes to, managing those evacuations really well. I wouldn't, I guess this is a really long-winded way of saying, I wouldn't do anything dramatically different. I would just say, we need to think about that in terms of just the regular egress, if there isn't a tornado setting down or a fire chasing us out.
Yeah.
What do you
Jim,
think?
what's your take on that one?
Yeah, I think it goes back to the risk assessment. Yeah, that if the threat is such that large numbers of people are likely to perish or get harmed, if they don't evacuate right away, then you evacuate right away and you take your chances on the COVID. It goes back to the unique use case. And when it comes to risk assessing it, there has to be, I think, some values for, is this risk take the worry away from COVID and get everybody out of the building, or is this risk COVID is the overriding circumstance? So I think you got to prepare for both options.
Yeah, I think it's interesting. Actually, I did one of my little 2-minute thought videos on this exact topic because it was coming up so much. I must remember to put that live somewhere at some stage. Again, in the chat, people seem to be thinking the same thing. When you consider an evacuation, at that point in time, the imminent threat would be taking precedence over the physical distancing priority for COVID. But again, Michael made a good point, which is important as well, is that when you get to that muster point or the assembly point, that then our plan should factor in the physical distancing at that stage. So perhaps when you do what we're suggesting, I think, which is review your risk assessment for those emergencies in light of COVID, you may find, for instance, I'm thinking out loud here, but you may find that your assembly or muster points are not now fit for purpose, perhaps, or maybe they're more fit for purpose than ever they were because your capacity is going to be lower anyway. I think what's important, along with probably accepting the emergency takes precedence, is document that you've thought about it. So if nothing else, document that you've gone through your risk assessment, you've adapted it, you've considered it. Don't ever be in a situation where, heaven forbid, whether it be a judge or a solicitor or a lawyer or whoever, can look through your documentation and go, nothing here indicates to me, Mr. Breen, that you even considered this. I mean, that's a shitty place to be. So I would say, let's go back, do our risk assessments and do it with COVID in mind. And you'll probably find little changes that might need to be made. All right, I think we're into kind of the questions that are coming in the chat. I scribbled a few down at the start because I knew to get really busy and I knew they'd disappear off the bottom of my screen. So we may have hit on this slightly already, but one of the questions was, have any of us seen any actual true innovations that have come out that might really be, I guess they're talking technological stuff, that could really help or could really help get us back going or be some sort of a solution? I think, I'm assuming a bit of a tone in the question, I think that the true bit in there, might be leading us to go, look, there's a bit of snake oil going on, but has anyone seen anything that they do think from a tech or an innovation perspective might be something that helps us get going again? Janet, what do you think?
There's some interesting things that I've been hearing about, but I don't know how functional they are. I had an email about something that was a bracelet that everyone could wear, and it would beep or vibrate when you were within the 2 meters. I don't know how they work. I don't know if they're effective, but that was interesting. I imagine if you were at in line for something, you would probably hear a lot of beeping and like how long do people listen to that before they chuck it in the garbage?
We did look at something similar though, and I did find myself wondering, might something like that be quite useful for build and break, for bump in and bump out? But if it was just the normal cue, I think it'd probably drown out the music with the beeping, perhaps.
Yeah, that one was interesting. I've seen some stuff about the lights, the UV lights that are supposed to, turn on and disinfect everything. And there was someone from a theater who was asking about what I thought of that. And I thought, I don't know if there's science to support it right now, but my understanding is that it would not replace cleaning. So you got your cleaning and you got your disinfecting. So, if you're talking about, I'm just going to turn this thing on in my 1,000-seat theater between shows, I think you still have to go in and wipe your high touch points, your armrests and your door pushes and all of those things. But it's interesting. I don't know. I'm not seeing enough where there has been sufficient science to support it. I wish I had. And certainly if you guys see anything where you got a magic bullet, bring it on.
I want to hear Jim, because the Americans don't believe in science, he told us already.
That's right. No, I think
that you think might be a silver bullet or vaguely approaching it?
Well, I think the most innovative thing that's come of all of this is a new and a more higher expressed concern for safety. So, what's the innovation is, many of those event planners who maybe thought about safety as a secondary concern are now thinking of it as a primary concern. Right. So, sometimes, and that's where the ESA came from. Sometimes it takes a disaster for people to come together on an idea. And it's my belief that at the moment we've got a lot of people focused on safety, and it's a good opportunity for us to make sure that we're considering the factors that could cause harm. Right. So yeah,
it's as if you knew the one other question I frantically scribbled.
Did you?
Earlier on, which is where someone asked, is there a risk that what will happen now is that promoters or organizers, rather than increase budgets overall to allow us do our jobs better, will actually pull from elsewhere to pop into the safety budget, and now there'll be deficiencies elsewhere? So someone is wondering if literally those tables might turn, where we've always had it being pulled from us for a new fancy light or something. Is there a risk now that it'll just be funneled into safety to tick all those boxes, and elsewhere there might be deficiencies or there might be gaps left? What do you think, Janet?
Well, so what I think we're seeing for the first time in history is that effective health and safety protocols are going to make the difference in whether we can reopen our industry or not. Like, they are top drawer. I think that the whole financial viability is a question that I can't begin to contemplate, but Jim probably can. But there was a really cool thing. I was part of a discussion for production managers and technical directors. And one of the guys on my panel was a production manager for a theater in Vancouver, and really clever guy. And so what he's doing is he's doing risk assessment first, figuring out what they can do, what they can realistically accomplish with the restrictions that they've got, and then they're programming based on that. So it's really looking in the other end of the telescope. Now, it's definitely going to be, an infringement to some degree on creativity, but I think we're going to have to accept that in the short term and build events that can work within the restrictions and do them extremely well. And for that, I mean, sure, bring it on. Bring all the money to the production budget. Let's have all the bells and whistles we can possibly include safely, and then let's build out from there. But I just was so impressed because, this is someone who had attended a safety thing I did at least 10 or 12 years ago. And so suddenly when he's using the words risk assessment first, oh, the angels sing.
Jim, what do you think?
I share a comment. Sorry, what was that?
More money for us in the safety budget? No.
Well, no, we're still going to be the least sexy kids at the dance because we're handling the backside of the PowerPoint, as Tim Roberts loves to say. But I do think Janet's right. I think I've been saying the designers have to recognize now when we come back to work that we're coming back in a different place, and we can't spend all the money on the latest bells and whistles. And in fact, I'm sure the vendors would support that idea as well. Let's use the stuff that's on the shelves and already paid for, so we can start, getting some of this revenue back into our ecosystem. And I don't think that doing more with less is a bad challenge, Janet. I think being able to demonstrate your creativity with less resources is a true mark of a true professional. That, hey, I can make this really interesting for you because I'm looking at what I can do, as opposed to what I would like to do. And that for a minute in time, for whatever that history and time is going to be, we do have to back off these large scale events, I think, and focus more on community at our events and how can we be clever given the circumstances. If it's going to be 50% capacity, we're smart enough to figure out how to make 50% capacity be interesting. That's what we do for a living. And it's the same, I guess I feel the same way about the drive-ins. While it may not be something I would attend, and maybe it would, we can get really clever about how a drive-in can be super fun and how we can make the cars be a part of the event. So I do think that we can create the solutions needed under the different circumstances, and maybe the profit margins won't be as big, but I think we can get people a good time.
I have to say, I can't remember the name. There was a cooking show in the UK where you're just given 5 random ingredients and told, go make something good.
Right.
So I'm thinking of similar when you go into the warehouse. What gear do we already have? What resources do we have? What staff do we have? What can we deliver with this?
Right.
Because we're not going to have the outlay to go buy loads of shiny new stuff like we normally like to. So again, yeah, it'd be interesting to see. Janet, I do think that's fascinating, though, to start with the risk assessment, given the situation we're in, and go, right, here are the limitations that we figured out in the risk assessment. Now, what can we create? I think that's it. I'm going to go and do that now. I think that I'm going to start something that way and just see how much I feel like it curtails me. You know what I mean?
Yeah. And let's make sure that we're keeping at the center of all this. Because we go down the path of capacities and patrons and money, but I really think we got to keep the artists. We have to find a way that artists can create and practice their craft. And sometimes that's not even going to be performance right now. It may mean offering venues so that people can rehearse, if they can form a bubble with their band so that they can have those experiences of playing live, doing hybrid events. I think hybrid events in Canada are going to be really important, where we can hopefully get them back into the venues, maybe of a tiny audience, and live stream it. Now, how you make money off that is still, wishful thinking, I think. But, I'm heartbroken for everyone in this industry, but we really got to take care of artists.
I think, as I was reminded recently, I say we, generalization again coming up, we often kind of temper what we say with, look, I understand people have to make money and promoters are in it for the money. As someone pointed out to me quite recently, and it was an eye-opener even for me, it said, look at your clients. It said, a lot of your clients aren't in it to make money. They're not private promoters. So if you look at local authorities or municipalities and stuff like that who have budgets to run events, that aren't actually looking to make money back off them, they're there's scope there. It's not always a financial bottom line, even though we all do tend to get caught up in that part of it maybe. And if I can't have the capacity, then I can't make the money. There are plenty of clients we know and events that happen around us here that they'll happen differently, but they're not driven by someone has to make money off them. And I think that's interesting. And I find myself forgetting that a bit sometimes. This might be quite specific as a question, but Marwan has asked, I think when we were talking about the likes of thermal scanners and things, those disinfecting gates or those disinfecting boxes you guys might have been approached about where you walk through and you get sprayed. If it's the Marwan I'm thinking of, I think he's operational out in the Middle East, so I'm sure they're seeing all of the shiny options.
Yes.
And again, look, the question is that a good option? Or in your opinion, is it just a false safety measure? Again, I would go back to kind of the science of it. Instinctively, I think from an experience perspective, people aren't going to like it. If it 100% makes you completely safe and sterile and then you're off into a gig, maybe they'll consider it. But getting sprayed with stuff externally on your skin, on your clothes to get into a gig, that's where my head's at. But I'm going to echo what Janet said earlier. I don't know enough about the science of those things. Someone could be sitting there going, they literally make you 100% safe. I'd probably jump in one tomorrow if it meant I could watch the Foo Fighters live from the stage.
The virus is inside our bodies. So unless you're going to...
I love that.
Some people suggested such things. But if you're going to fire disinfectant down my throat, I may not survive it, but it may cure me of the virus.
But I mightn't have COVID on my deathbed.
I'm not a scientist, but intuitively walking through a car wash of disinfectant does not feel like when I get out the other side, I won't be able to cough on you and make you sick.
Well, I mean, that goes back to, and it seems to be a hot button issue, but it goes back to the temperature thing. The greatest, the current science is you are most infectious to other people before you show signs, before you have a temperature. So temperature checking isn't going to keep someone who will expose your audience necessarily out of your venue, because you are most contagious before you have the fever. At this point, that's the science. And the same would be true, as Janet said, it bears repeating, that spraying me with disinfectant while some actual governmental leaders think that that's a good idea does not do anything about the virus that's inside of me that I might be communicating outwardly to people in the venue. And I think that while I applaud everyone trying to find solutions, stick to the science.
Yeah, I think being, and that coming from an American, but no, Marwan, be led by the science, and I know there's a definite danger where you're operating that all the shiny stuff will have money thrown at it and we'll all be walking through them. But I think that's the science is the key here. I'm conscious of the time, and I'm also conscious that the chat's been moving so fast that I know questions have disappeared off the bottom on my end. So if anyone has a burning question and are very annoyed we haven't gotten to it, please pop it back into the chat and I might see it before we finish up. Ray's made a good point here. He sent it to me privately. I think he meant to send it to everyone. But I think it's Janet coming back to what you were saying about artists and stuff. And this is something I've had a few venues talk to me about. And Jim, actually, I'd be interested in your opinion on this. An opinion or a potential solution to the world going forward that I've had put to me regularly enough is as simple as this. And you can probably tell me exactly why this is not simple. That an artist who used to come to the arena here in Dublin to play 3 nights of shows to make X amount of money and to make their living and earn their crust and all of that, maybe in the new world, if capacities are way lower for a while, comes and over those 3 days, maybe they're doing an early show and an evening show, an early show and an evening show, an early show and an evening show. Now that's a completely different world for an artist, and I understand, sound checks. There's lots to unpack there. But someone to me who runs a big venue said that's what we're suggesting to them. If they want to be making the same kind of money, but we can't put the same amount of people in, let's look at multiple shows. He goes, we know how we can make that work for our venue. And he's wondering, he's had good early kind of shoots of response from the artists that they're trying to rebook for dates that had to be cancelled. So Jim, I might come to you on that one first. What do you think of that? Are artists going to think that way? Is that where they'll need to be?
Well, the artists that I speak with are not inclined for that solution. Now, again, artists are in all shapes and sizes as well. So I do personally think that there is a solution in there somewhere, that a multiple night engagement can reduce the overall cost of trying to hit 5 cities in a week, very obvious, and can therefore entertain the audience that you might engage in 1 or 2 nights if you were to do multiples. So I think the highlight there is, Mark, we all need to be thinking in every direction until we find those key moments that will work. And I know the managers are, I know the big promoters are, I know the artists are. Everybody's trying to work this same problem, as are we, from multiple directions. So will multiple nights be a possible solution? Yeah, I think that's going to be one of the things that we can do. Now, will the artist do it? I don't know. But it certainly does seem reasonable to think that we could.
Yeah, and I agree with that. I think I know of at least one sort of municipal performing arts center where they're looking at trying to bring in a 75-minute show, maybe a single comedian, a small staged reading, a couple of musicians, and start with that and get that right. So have a very small audience, but also shortening the show so that hopefully people's bladders will, for the most part, hold and they won't need to go to the washrooms, no intermission. So do a 75-minute show, take the time to do a thorough clean of the venue, and then do a later show. So this is going to require compromise on all sides, whether it's the crew, the artists, the front of house staff, all of those things. But there's a lot of creative ideas out there, and I'm energized when I hear people talking about how they think they might approach this. There's a theater where they're talking about using a patio, so doing a sing through of a musical outside with people sitting at a patio. So, again, these are teeny tiny things, but there's such an appetite for live. And yeah. I don't know what you guys are feeling. I've seen some really cool online content, some streaming, which is fine and enjoyable, but it is not the same thing. It does not scratch the itch for everyone who wants to see something live. I feel that's just my opinion. But
I agree, it's not the same thing, and I think, but it does. The first live concert, television broadcast, no audience. I think it was Garth Brooks and his wife. There was some hope there. There was, we watched it and it was good musically and it was entertaining and it did provide a little bit of hope. Like, look, music's still alive. The artists are still out there. They're still trying. The artists are reinventing all the time. And I agree. Those of us who live in live events, we're a long way from getting back to that, and that's the experience we want. But at the same time, we have to recognize we are where we are at the moment, and what shots of it can we take now in order to pull us through to that point in time where we can all be gathered and sweaty in a field together again.
Yeah. Oh God, that's it. It's that being sweaty in the field together again that we all need, whether you're front of house, back of house, or in the audience. I think I'd take any of them at the minute. I'd happily work. If anyone knows me, I would work. What would I work? I'd work a Justin Bieber concert at this stage. So that anyone who knows me, that'll tell you. A couple of things. Marwan had another question there about security that Pete Dalton has kindly jumped in on. Marwan, I'd leave you with Pete on that one, to be honest. He knows what he's talking about, and he's come up with some good stuff for you there. I did see a brilliant question, which I thought would be really nice to finish on. Andrew, sorry, you did ask it earlier, so thank you for putting it in again. Could the panel, no pressure guys, could the panel bullet point what the next 12 months may look like in terms of mass gatherings? There's that phrase again. But I guess, live big shows like we all love and want to get back to. What does it look like, do we think? Janet, you want to take that one first?
Could you ask me a happier question?
Well, maybe I might find a happier one to finish on if we get something.
Yeah. Okay. So, and this is just my guess, shot in the dark. In terms of indoor theaters, most of the theater seasons I'm aware of have been canceled, certainly in Ontario, up until about May of 2021, with the idea that if things improve, then things can be put together, smaller things, different things on shorter notice. But there will be very small amount of live theater indoors with a full house for, I'm guessing, about a year. We hopefully will be given the go-ahead to do more outdoor kind of events, possibly by August. I think that's really a stretch, but in some provinces that may happen. We may be able to continue with some outdoor events up until the snow flies, which can be, anywhere around Halloween. And then that's going to put us out of the majority of outdoor events until spring. If we have good weather, maybe we'll see some Christmas, New Year's outdoor stuff. But if we have a nasty, cold, horrible weather, where I live, that may be pushed off longer. Big outdoor festivals, maybe next summer, maybe. Depends how we do with shutting down phase 1 of the pandemic. Depends how we do phase 2. Depends if we have echoes of 3 and 4. I don't know. That's as optimistic as I can be right now. Jim, do you have any?
This is a sad question for me because
heartbreak.
First of all, I live where I live and in the States, and we're not doing what we need to do to help bring this under control. And my aspirational voice says that between now and a vaccine, we're going to find more clever ways where we can gather and have events together. And I would say that maybe I'll steal this from Tim Roberts and Andy Lenthal, go away from the idea of mass gatherings and start calling them the organized gatherings. And that might make it more palatable for some who are concerned about the things that we try to achieve. But I think that the real benchmark for back to a time like we were in March is probably a vaccine. I think that that's obvious. And a vaccine, and possibly coupled with an effective treatment. And I think in the interim, we keep experimenting and we keep trying new things and we keep trying different permutations of what an audience capacity looks like. And we keep trying different safety measures, and we just keep trying until we get to a solution for the disease. But I don't think we're back to where we were without a solution for the disease.
And the reality too is, and I don't want to rain on your parade, is there's a lot of magical thinking going on about vaccines. A typical time to develop a vaccine is about 4 years. HIV still does not have a vaccine. It has treatment, and certainly that disease has become manageable. But I think we're going to have to really count on people being innovative for a good long time. And I think they can. The people who I work with in arts, entertainment, and live events are skilled, talented, and this is a time when I think creativity and problem solving are our superpower, and we need them more than ever right now. So we need all those creative minds working to find alternatives, maybe, to how we can enjoy live events together. But I'm not hanging my hat on a vaccine. I just think it's a bit elusive. I want to hear something more promising about a safe and effective vaccine before I start to see an endpoint to all of this.
Yeah, Andrew, I think your question having the next 12 months in it has kind of dictated your answer from the three of us. I'm ever hopeful, I cling to hope, but I think realistically, I don't, right now, with everything I know today, I don't see next summer's festival season in Ireland happening the way it always has. I don't see it. I know there are some hopes among some of the promoters to do some stuff even between September and December this year. And I get it, and I love it, and I love the drive that's trying to get there. And I will love if they do it and do it well, and we don't see spikes in cases and everything. I find it hard to believe that's achievable. I really, really want it to be, especially seeing as one of the venues I'd love them to put it on in is 100 meters up the road from my house. And it's outdoor. But I think realistically, I don't want to get anyone's hopes up. I'm just reading Roger from Formula E there again has said the next 12 months for him, replanning, setbacks and baby steps. And I think that's it. And I don't think I would actually, and I'm not as involved in I think the types of arts events and stuff, Janet, that you would be, but I see lots of innovative stuff and thinking, and I think I see artists coming up with things that, and as Jim said, they may or may not work, but I think we all need to be trying things. I think we need to get behind stuff, and personally, I'll get behind stuff even though I'm not convinced it'll work, because I want to be proved wrong. And if I can do my part of it, if I can make it safe, I'll hope the rest of it works, and I'll hope people are into it and they dig it and they want to do it again. And I think if we all approaching it with that agile and open mind, I think, as Jim said earlier on, we all need to be having these conversations. We all need to be at the table. Let the artists come at it from their direction. Let us do what we do. Let the promoters pitch in. Let everyone look at stuff and see what can work, what's worth trying. But I think to answer Andrew's question, we're more than 12 months away from us being able to say, Jesus, that was all a bit mad, that COVID thing. Glad we're back to normal. I think we are more than the 12 months away from that for me personally anyway. Yeah. And again, I'm trying not to end on anything that's not encouraging, because I'm seeing lots of good stuff being talked about. And I think some of what needs to happen is some people, and I'm one of them probably, needs to really, really accept that things are different for at least X amount of time. Now let's go at it. Let's go new. We've kind of done it with the webinars, hoping that people would be into them and we'd form a greater kind of community. This sounds really poncy, but let's try new stuff like this. Let's all talk a lot more. Let's all learn from each other. And I'm loving when people fire me random emails or send me stuff going, do you think this might work? Would people be into that? I'm open for looking at everything right now. My business partner, Martin, has been hearing that for weeks now, where I said, all the stuff you bring to me that people brought to you, and I'd go, no, we're not into it. Everything, let's look at everything now. And I'm not talking financially. I'm not talking from a staying in business perspective. That's important, but just anything. I'm kind of open to things I maybe thought wouldn't fly before, things I'm not into myself. I'd have probably sat and watched Gareth Brooks live and to see would that work, even though I wouldn't fancy his music. But I think everything, for most of us dying to get back to doing something, I think we accept the something we do for the next while, maybe 12 to 24 months, is going to look a bit different. That's not to say it's bad or we hate it or we don't enjoy it, but it's got to look different. Has to.
Yeah, look, one of the biggest benefits, I think, of this downtime is that we're doing this. We're talking to each other more, and we're finding a way to do it civilly, and we're doing it without, in most cases, the need to promote business opportunities. And we're having meaningful discussions about how our community can work together and solve problems together and get smarter together. And, this is a really important time. As painful as it is, it's also really great at the same time.
I've been seeing people, just to try and pull us back to that optimistic point, is I've been seeing people who are taking on, they're going, I can't do a show right now, but I work for an AV company or I work for a theater venue. I'm going to update my health and safety manual, or I'm going to get some of that online training I never had time for. The conversations are incredible. And so I feel like, it's a very strange pause. And a lot of the time we're just trying to cope, right? Like we're going through all those different feelings of, I don't have work. My husband doesn't have work. Lots of people don't have work. So we're cobbling things together, but we're trying new things. We're baking things. I ironed all my tea towels. I'm doing some of these wild, living on the edge kind of things. But for the most part, I'm meeting up with people who I may have known through email, and people will email me and say, they might think, oh, look, Janet's a consultant, and they send me an email and say, can we talk on the phone? And we do. And so I'm finding it also now that I'm past sort of that weird kind of oh my God, what's going on? I'm now able to really embrace the conversations and the wonderful people who are part of our industry that are so smart and diligent and creative, and I'm loving that part of it. And I think we will go back to all of this, hopefully, evolved from where we were when it all started. That's what I'm hoping.
Yeah, no, I think you're right. Even if we look at something as simple as from when we started these webinars, and I think this is our 14th or 15th, all completely different topics each time. The amount of people, my eye gets caught in the chat so regularly with blue links because people are putting in their LinkedIn. And the conversations, like I'm like you, I'm encouraging people. The worst that happens with me is it takes me a day or two to come back to you because I'm busy. But like, talk to me, reach out. The amount of people I've had discussions with on email or on Skype or whatever that I may not have known, may barely have known. I knew their name from talking to them on LinkedIn. We have to, I guess this sounds a little bit trite, but our world is different for the foreseeable. So let's make as much good, pull as much good out of it as we can. If you can forge some relationships, if you can get some, as someone said to me recently, you're just giving people free consultancy when they email you and they, can I run this by you? Can I have 10 minutes? I get that. I 100% get that. I'm not telling anyone anything that's going to land me in court, I don't believe. But if we can help people, if we can foster that type of community, then 5 years from now, when this hopefully is in the rearview mirror a bit, maybe we're all a bit stronger, and maybe that lovely feeling we all get on a site is even nicer.
That's right.
And maybe we're really starting to see faces that you're going, man, like I only got to know you when that COVID crap was going on, and now we're on shows together or whatever. And that to me, like exactly. Yeah. I'm not sitting here crying into my dinner every day. It's shitty at the minute and we're not on shows, but I guess we're all trying to pull what we can out of it. And I'm actually really encouraged by the amount of people actively doing stuff. Like I've had people get in touch and go, look, I'd never normally do this, but you say this on every webinar that people should get in touch. So here I am. I mean, that's it. If it took 7 webinars for me to push you to go, Mark, can I run this by you? Or you might be able to help me with this. Can you connect me with such and such? I mean, that's how I'm choosing to try and make use of it, as well as helping those people, Janet, like you said, who go, right, I'm going to go out my health and safety statement now, or I'm going to look at this weird idea I used to have, or Mark, remember that course you and I said we'd put together? Let's do it. Like all those things are bubbling back up again. And I've said to someone recently, because of COVID, I've taken, where are my hands in it? I've taken my to-do list to a degree and I've gone like this. I'm starting at the bottom. You know, all the great ideas you have that get pushed down.
Yeah.
I've been able to go back and go, oh, I'm going to break the back of that now, or I can go at that and I can do this, or I'll ring her and I'll try that thing we said we'd do, and she's not available. That's fine. I cross it off the list. But I mean, we all have to make the most of it. And I think, as Jim says, we're doing this. We're talking. This is good. And who knows where any of this leads for any of us down the track, or the people in the chat who are making new friends. And I think there's a lot of, I'm not looking for good. I think there's a lot of good actually happening during this whole lockdown situation globally. And because I'm not having to look for it, it means an awful lot more to me. And I think it's more real, that it's just bubbling up. Good things are, turn left, there's something good. I go onto LinkedIn, there's something good. My email, someone sends me a link to, there's a fire officer here in Dublin, and we've oddly developed a stronger relationship, I think, during the lockdown, because we're keeping each other up to date with stuff. And I find a document, or I find something, I send it to him and he does the same. And like relationships are getting, I'm waffling now, relationships are getting stronger, I think.
I'm worried that COVID will end before I clean my office.
You have no excuse.
And let me tell you, look, Alan Wilson was genius. I'm so glad he was on this together with us. He was amazing. Oh, shucks. Yeah.
Actually, I should apologize. Clearly, Alan got kicked off and technology messed with him in Australia and he never got back to us. So I do apologize. You only had 3 of us to listen to. Lots of people saying thank you and having to head away. I'm going to quick scan for any major last minute questions. What's that I marked?
Miss you, Emma Stewart.
Hi, Stewart family.
That's a good point. Yeah, we're missing the big live events, but we'll appreciate them all the more when they come back, and that's 100% true. Like I probably, if the first big gig back in Ireland where I feel safe to go to it is Bieber, I'll probably be there.
Hey, now Mark,
I need to stop shitting on Bieber. Like I'll probably go, you know.
You know what?
And I feel like you're about to defend Justin Bieber, are you?
Okay, I'm just going to tell you, Mark. Justin Bieber was in my daughter's grade 6 class. I live in Stratford.
You're going to tell me he's nice as well, aren't you?
He's not.
Oh, he's not. Oh, brilliant. Okay, I don't like his music and he's not nice. That's the end of that then.
Anyway.
Right, I think we're all getting a little bit delirious now. Thank you, everyone, for joining us. Janet, Jim, thank you both. Thank you, Alan, if you're still listening. I don't know, are you? I really apologize. Technology.
Thanks, Roger Hooker.
Messed with you. Thank you, Roger Hooker. And again, I always say this on these webinars, but thank you to all you people in the chat for having your own conversations, doing your own thing, helping each other out. When you've got hundreds and hundreds of people on here, we're not getting to everyone's question. I fully understand that. I do not care what conversations you ignore me completely. Have your own conversations over there. Help each other out. I love to see that. And I know Janet and Jim do too. And if you got a little something from what we spoke about, all the better. And yes, the likes of Roger and Andrew and Michael White, everyone who's helping people out in the chat there. That's what I'm talking about. That's what it's all about. And that's what personally I'm really enjoying in this really weird time that we're all in. So I shall leave you on that vaguely positive note. And we'll say goodbye and we'll kick everyone out of the room. And I shall just thank you all and say stay safe.
Capture all these LinkedIn addresses.
I've lost all the LinkedIn addresses already. Technically, I can get them to you, but they're not going to be in the most readable. Actually, you could just Control F, look for LinkedIn, and I will send you a file. It won't be pretty though. The way this thing kicks it out to me, it's not pretty. But I will send it to you. And actually, for what it's anyone else wants that, let me know. Send me an email. I'll give you that chat file, which will have all the chat in it, and you'll be able to catch all those LinkedIns if you missed them. Right. Okay. That's enough done for LinkedIn.
Thanks, everybody.
Thank you, guys.
Thanks, everybody.
Days wherever you are, and we'll see you soon.
Stay safe.
Take care.